Hello everyone, and welcome to the Henry Schein webinar series on YouTube. I'm Dr. Gary Severance. Today we're joined by Dr. Nathan Suter, a practicing clinician and owner of Access Teledentistry. Dr. Suter today will be going over not only how you can properly use teledentistry for your patients or to keep in contact with your patients during this pandemic, but will also share with you how you can make it a valuable added service to your practice as you reopen. Here's Nathan for you.
Thank you, Gary. I really appreciate the invite to present today. My name is Nathan Suter, and I am a general dentist. I have a private practice, and I also do consulting on the topic of teledentistry. My company is called Access Teledentistry, and today we're going to go into practical uses for teledentistry for COVID-19. Just a disclaimer that I do consulting and I have multiple clients that I've listed in the slides, including Enable Dental Group, Mouthwatch, LLC, and the Department of Health and Senior Services of Missouri. I graduated from the University of Missouri, Kansas City in 2013. And from there, I started at my community health center. I started the dental program there and was the dental director. And for 6 years, I worked there and developed that program, became the board chair of the Missouri Coalition for Oral Health during that period of time, received some honorary awards from the National Network for Oral Health Access, Clinician of the Year in 2016, and also in 2016 received an award from the American Dental Association's Dr. David Whiston Leadership Award. Most recently, last year, I received an award as Missouri Dentist of the Year from the Missouri Dental Association. And just a couple weeks ago, it was announced that I was on the American Dental Association's Top 10 Under 10 New Dentist Award. And it's a timely award because that award was given to me for my work in teledentistry in the state of Missouri, as well as helping people around the country learn about teledentistry. After I graduated from dental school, I worked at a community health center, and I was the first employee there. And over that 6 years, I developed the program and grew it to the point where we had 12 dentists, 6 dental hygienists, a total team of about 60 staff members. We had 2 fixed clinics, traditional dental offices, 1 mobile clinic that was in a 53-foot tractor trailer. We had 3 clinics that were regular offices inside a school building, serving children and their parents. And we also had 3 portable dental clinics that were our pilot program for the first teledentistry program in Missouri, doing 3 portable clinics that went to school. We also saw patients that last year that I was there, we had over 9,500 unique patients for a total of over 22,000 visits. We saw during that period of time our first pilot program that served 1,200 patients using teledentistry. And during that pilot, we trained all 12 dentists to do teledentistry and trained 6 dental hygienists. We primarily focused on 33 schools, a nursing home, and 2 primary care offices. And that program started in 2017. I own a private practice called Greenleaf Dental Care, just outside of St. Louis. And I've been using teledentistry there for 2 years. And we've been using teledentistry mostly for hygiene coverage. And so we've used it to cover when I'm at a conference, doing on vacation, and occasionally if I have a sick day. So it's on average around 20 hours a month, but that increases my hygiene hours by about 22%. So how that works is when I'm out of the office, the hygienist gathers diagnostic data, and I create a treatment plan later, either remotely using software, or I am doing it the next day when I get in the office. I will review the chart and do an exam. And so that's how we use it in my private practice, doing teledentistry. I also with my work with the Department of Health in Missouri, I have developed a 2-day training program on how to teach people about teledentistry. So we go over policies and procedures and things you should consider. We give lots of examples of how people are using teledentistry across the country, and we dive into how to capture adequate diagnostic data and do note taking. And this is a hygienist to a dentist model that we've done this training on. And so we also have hands-on with the technology. So we have different cameras available to try and softwares that people can get their hands on and actually kind of practice taking pictures on mannequins. And we also have sample cases of real teledentistry charts that we give people scenarios on how to do a teledentistry exam. I want to start with just a little bit about the pandemic that we're experiencing currently and how teledentistry might give us the tools we need to move forward in dentistry. And this was an article that I read in the Atlantic the other day, and it essentially says that everyone wants to know when this will end. And these experts that are epidemiologists say that that's not the right question. The right question is, how will we continue going forward? I've got a picture here of the good old days just a few weeks ago where we were doing dentistry, how we've been doing it. And I also have heard the analogy that it's more like during World War II, after the bombing, the Blitz of Britain and the bombing of Britain, and seeing all these British workers going to work through the rubble. And that is probably an interesting analogy to show us what the next 3 to 9 months at least might look like going forward. The new normal is going to look something like this picture in this slide. We are going to have a lot of PPE that we are being advised to wear, full head coverings, N95 masks, disposable gowns, and that is going to be the new normal going forward, at least for the short term. So what is teledentistry and how does that apply? I'd like to start with just a little bit of the literature to show you how teledentistry has been studied for the past few years. And this first study is a literature on the diagnostic accuracy. Over 235 patients were examined in Europe using teledentistry in a nursing home, and it showed how sensitive and accurate a teledentistry exam could be for pathology in particular. And sometimes that is the harder thing to diagnose is the pathology. And so that literature is available. There's a link at the bottom there, as well as increasing access to care. So this is a study by the University of Minnesota School of Dentistry, and they measured how they were able to do consults from specialty offices into rural areas and reach people and save them over 200 miles of driving and over a difference between an 18 hours of lost work or school time versus just less than 2 hours of lost work or school time whenever you're able to offer teledentistry outside of a metro area. And then finally, there's a longer term study that's been out there from California where the University of Pacific showed 3 different dentists doing virtual and direct traditional exams and showing the very slim difference between the same exact patients getting examined virtually versus direct. And that each dentist had a very small difference in how they decided the treatment would proceed. The main difference was really between dentists, and we can all understand how that can vary. Also, teledentistry has grown very rapidly in the conscious awareness of the dental profession, and this is just a slide showing how from March 2016 to April, how many people Googled the word teledentistry and looked for it, and it's almost 4 or 5 times more people looking for it than normal. With teledentistry, there's really, what I tell my clients is there's really around 8 ways you can apply teledentistry. Okay, in this presentation, we're going to go into the first 2 mainly. And so Those applications are, the first one is limited evaluations and triage. There's COVID urgent and non-urgent exams you can do using teledentistry. You can use hygiene only coverage, like I alluded to in my what I do in my practice. You can use teledentistry to do satellite office coverage using a dental hygienist or a team member that is legally allowed to in your state. You can also do specialty consultations like that literature had shown. Traditionally, when teledentistry has been used mostly across the country, it's been using outreach applications, going to community sites and schools and nursing homes. There's also many cases where it's getting used around the country doing medical dental integration, particularly in the public health sector. And then also there's this developing area of teledentistry, which is patient monitoring devices. And in dentistry, it's really in its infancy, and there's a lot more concrete examples in the medical industry on how they're using connected devices to give the doctor tools to help their patients and to be connected with them. It's important when you get into teledentistry to understand a few terms. So I'm going to spend a little bit of time going into some terminology. The one is the legal definitions. These legal definitions can really vary state to state. And so the first one is your originating site. Your originating site is the site of where the patient is. And so the patient location needs documented in your note, and the distant site needs documented. The distant site is where the doctor is during the examination. The second thing is the patient presenter. If for example, you're doing traditional teledentistry in an office where there's a hygienist sending the data to a dentist, then the patient presenter is a hygienist. But if you're doing triage through a software platform directly with the patient, then the patient is the patient presenter. And so these are terminologies across telemedicine, telehealth overall, the umbrella of telehealth, where teledentistry, teledermatology, teleneurology all fall under. And so these are terms that we need to incorporate into our documentation as we start to offer these services in dentistry. The main two terms you really need to understand is synchronous and asynchronous. And these both have codes from the American Dental Association. And the first one is synchronous, which is what most people can think of when they think of teledentistry. They think of a video chat between a doctor and a patient. And so that is D9995, synchronous communication or live communication with a patient. Or it could be a live communication with a dentist and a hygienist at a remote facility. Okay? And so that is synchronous teledentistry. Asynchronous is when information is stored and saved to be reviewed later by the dentist. And so that is called asynchronous, D9996. And so those are the two codes that you use to code for your procedure to show which form of teledentistry you're actually providing. We'll get into a little bit of regulatory policy things. These are things you just need to consider and kind of have a grasp of before you would implement a program. So the ADA has some resources available. If you some of it is free to anyone. Some of you have to be a member to access, but there are documents that I've worked with them to create. So they have some documents available. They also have a recorded webinar that goes a little bit more into the basics of teledentistry terms and also examples on clinical notes. You need to understand that state rules of teledentistry vary by state. Governments are the ones that decide what you can do for teledentistry. So you need to check with your state dental board and also your insurance companies to see exactly what you can and can't do, and also what's reimbursable. So a lot of states, the majority of them, have implemented emergency use of teledentistry, and that's what surged the awareness of teledentistry. And so with emergency usage, for a period of time during this pandemic, we're encouraged to use teledentistry to keep us and our patients safe, to evaluate them and to determine if it's safe to see them or if it's even urgent enough to see them. And so you need to look at your state's rules. There's a great resource center. It's called the Center for Connected Health Policy. You could go to their website and click your state, and it gives you examples of what is allowed. They also will answer your questions. So you could, as a provider, you could send them questions and get responses on specific questions that you have. The other main thing to remember is HIPAA compliance. So during the pandemic, uh, HHS and the OCR have relaxed HIPAA regulations around teledentistry in particular. So this is a direct statement from the OCR director that they are empowering providers to serve patients wherever they are to help reach people and to keep people safe. And so as long as a provider is connecting in good faith using telehealth, they're relaxing the rules on what things you can use, what products you can use. That is going to be temporary, but just remember they're going to have statements put out and letting you know when it's time to switch back to something that is HIPAA protected. The ADA has also issued guidance on interim billing guidance on how to do teledentistry exams. They've also issued sample language for informed consent. You also need to know that when you're doing a teledentistry exam, you need to document certain things in your notes. And so one of those things is you need to document where the patient is located. Like I said, that's called the originating site. And then you also, in this case, a lot of cases, if you're triaging directly, your patient's location is their home. So you're going to say patient's home. You can just say patient's originating site, patient's home on file. Your patient presenter, the patient. At the distant site, you would put your office if you're at the office. You'd put provider's home on file if it's providers. That way you're not putting the provider's address in the note. You need to also document what methodology you're using in the note. So you need to document if you're doing synchronous or asynchronous, and you need to describe the technology that you're using. And so you need to say, I'm using Zoom or Google or FaceTime or Facebook Messenger, whatever it may be. Then I encourage you to incorporate COVID-19 screening questions during your telehealth evaluations. And then you would list your signs and symptoms, and those the typical things you would do in your note. And then the critical thing that people sometimes forget about is you need to list how you're going to coordinate their care afterwards. And so that is sometimes forgotten, but whenever you're not in the office with all your staff, you need to make sure you're documenting so that no one gets lost in the shuffle as you get back into work. So you need to write if you're going to see them immediately. You need to issue if you're referring them to the specialist, if you're sending them to the pharmacy, and if you're going to follow up with them later, or if you're putting them on a wait list. We're going to get into limited evaluations and triage. It's the first application step in teledentistry that I've been discussing with providers across the country. And so limited evaluations and triage. The main purpose of this is to help triage an emergency or not, and to keep you safe from being exposed to COVID-19. So using teledentistry for emergency triage is just one layer of protection and allowing you to engage somebody before you decide to go and risk exposing yourself and your staff to them. And the ADA has issued these great guidelines on what is an emergency. Know that there's interim guidance on what is an emergency, but also you need to consider your risk exposure, okay? And so these are two different charts here. One is the ADA's workflow that shows you how to triage a patient, okay? The other is showing you just the amount of risk. And dentists, dental assistants, and dental hygienists are in the top 10 highest risk categories for COVID-19, according to multiple different outlets. And they base this off of your proximity, physical proximity to another person, your daily exposure risk to disease and infections, and how often daily you're exposed to other people, you're in contact with other people. And if you look at this really interesting chart, it shows dentists, dental hygienists, and dental assistants all the way to the right, which is the highest risk category. So what you could do with teledentistry, this is what teledentistry looked like in that first portion of the shutdown that occurred. From my perspective, is I didn't have a patient-facing teledentistry platform. My platform was hygienist to dentist, and to enact a way to engage with my patient I've gone through some phases to find out what really works well for my practice and my patients. And so these are two examples. In that first week, I used Google Voice, which is free, and you can communicate with the patient, and on their end, it's a text message. And so you can very quickly get a platform up and running to message with patients. And these are both store and forward solutions. And then if you have a Facebook platform for your office, you could communicate that way if you'd like, but that's only for patients that have access to Facebook. These are both approved under the temporary HIPAA guideline releases. If you are going to do telehealth for the long term, you need to make sure you transition to a HIPAA compliant option. I've evolved my process a little more into a more sophisticated way. And so I've been using a digital forms system. And right now I'm using FormStack to have a patient fill out a digital form that gives them consent. It's HIPAA compliant. They sign a teledentistry consent because there needs to be consent, and they are in the form uploading a photograph that I can look at. And so this is one patient's example. They lost a filling, they have low amount of pain, and they keep getting food lodged in that molar back there. And so we worked out a plan for this patient. It's not on the high end of emergencies. She doesn't want to lose a tooth, and she would like to just wait because she's worried about even leaving the house. And so we figured out a way to monitor this and for her to keep it clean so that she can wait a little bit for us to get this tooth taken care of. Right now, I use Dentrix. I have I guess it's G8 now, but G7 is the graphic that I found to illustrate this. But I created a workflow that has a little bit of moderate cost built into it to allow for patients to book directly with me while my staff is at home. Okay, and my staff is not at the office for the last 3 weeks, besides just a little bit of on and off to do in the mail and things. So I've automated a process for patients to engage with me and schedule on my terms when I'm available. So I have a website using Squarespace where they go and they can click a button and they can make an appointment using this wonderful program that I found that I've been having a great amount of success with called Calendly. There's a free tier for that. You can also tier up for more functionality. They make an appointment with me and it automatically schedules them a Zoom appointment to communicate with me. They also get prompted to fill out that health history form that I talked about, and they fill the health history and take a picture, and they load it into FormStack, and I get an email, and my office manager gets an email when they fill that out. We could download that as a PDF and load it into Dentrix whenever we get back to the office. In the meantime, I can either message them with Google Voice, and sometimes that's all it takes. I don't even have to do a Zoom conference. If I message them with Google Voice, that is asynchronous communication with the patient. If I'm going to do a Zoom chat, that is synchronous communication with the patient, and that's how the difference in documentation. Remember, in teledentistry, you need to, if you're going to bill for teledentistry, you're going to need to capture that with either a picture and message it to you, or you need to do a video conference, okay? And then I enter everything into Dentrix and I bill from there. And I've already been getting paid for my teledentistry exams from 3 different insurance providers. I didn't cover it because you guys, Henry Schein has offered another speaker to come in and talk about billing guidance. But just remember, when you bill for a teledentistry exam, you want to bill for 2 things. You want to code for 2 things, preferably. You want to code the type of evaluation that you're doing. And so almost all these are going to be D0140, and they're going to code the type of teledentistry that you're using, synchronous or asynchronous. And the asynchronous and synchronous may not be paid by most payers. But as far as telehealth standards go, you need to code for that so that it's documented that that's what you use to take your exam. This is what patients find when they go to my website. They go here. I've changed my front page to talk about teledentistry, COVID-19 policy changes. They can click to schedule an exam. They can book an appointment. I predefine my availability. I have a 3-hour gap between them at a minimum before they can book for me, so I have a heads up to review their form. And I have this nice digital form that they fill out, and it's sent to me in an email format. Then they get prompted back to my website where I put a page on there that shows video tutorials on how to do a Zoom meeting. And this is what a Zoom meeting could look like with a patient. I often get asked if these need to be recorded. It is not recommended to record any teledentistry video conferencing sessions. Not recommended. You don't record your clinic interactions with people, so you don't record this. If you did record them, it would be part of their record, and you would need to store it somehow. And if you do a lot of these, it's going to be costly. So just a little recap. With the technology that we have available to do these kinds of things. So you've got your traditional EDR, practice management software, and in a perfect world, you could take that and you would have a communication tool that is synchronized with that and can send some of your exam information into the chart. That would be the perfect world, okay, if that happens. The next thing is what Dr. Glassman and I presented to the ADA is there are these optimized teledentistry platforms, but and they do great ways of communicating with the patient and doing other things like that. But they sometimes can be duplicative in their features with your practice management software, and so sometimes you're getting more than you need. But what would really be optimal or perfect in my regard, in my experience, is just to have a nice secure messaging platform that lets you communicate in multiple ways to your patients depending on their technological know-how, so that you can engage your patients and record things, and then not record the video, but record your notes and things that you coding and things like that, and then transport that into the patient's chart. That would be the ideal situation. However, I found that most offices are just piecemealing together solutions that they're finding that around the tech space. So the workflow that I showed with you're using Zoom or you're using a digital form platform, those are the ways that I'm seeing most people kind of get off the ground running. The next application for teledentistry is COVID urgent, non-urgent exams. The main thing, if you want to do beyond teledentistry beyond a limited evaluation triage, is you want to use teledentistry to mitigate risk. The purpose of this is reduce your human-to-human contact unless you specifically have a patient you've deemed needs the human-to-human contact, because we're going to have a very large period of time probably where we can't obtain adequate amounts of PPE. And so you want a lot of offices are having patients stay out of the office. They're taking their waiting room chairs out, and they're messaging patients or talking to them on the phone, and then using teledentistry to communicate with them, and then intake just the person you want to come into the office. And if you have that kind of tool, you don't have to send your staff out to the waiting room. You can have them digitally sign their forms. You could get the forms submitted, and then you can have them wait out in the waiting room, and then just bring in the patients that you need. Or you can have them wait in the parking lot, and have them come in. And then you may not be able to take off your PPE to even do hygiene checks. There's so much PPE that's recommended to wear that multiple dentists have contacted me asking me about teledentistry, because they're thinking whenever they have to put on all that PPE and they are able to do checks in their rooms, they're not going to be able to easily take that stuff off and go over there and do a quick check. And so they're going to have the hygienist take all the diagnostic records and either video conference from another room, or they're just going to save it and they're going to do it at the end of the day. The other thing you want to do to think about using teledentistry for is just to mitigate your risk by separating your clinical staff or your staff into two teams. And so in multiple offices I've talked to, people are separating into teams that are not scheduled at the same time. And so you've got a diagnostic team where any patient is intaked through the diagnostic team. X-rays are taken, temperature is taken. I just was reading that one indicator is using a pulse oximeter to see if they are silently infected. There's some interesting literature coming out on that topic, but you can screen the patient with the diagnostic team, and then you clear those patients to see the dentist. OSHA has issued guidance in that regard. So minimizing employee contact, using virtual capabilities as much as possible, and using shifts creatively so that the diagnostic team and the treatment team are completely separate. So if one team gets exposed to a positive patient and is forced to quarantine, then they are or have to quarantine just because someone becomes sick, then the other team hasn't been directly exposed. You can see this in this graphic here. If that is a patient at the apex and you have a hygienist on the left and a doctor on the right, if that patient doesn't have to see the dentist, they're not exposing all those people downstream. And remember, if someone's positive and they're not symptomatic and they come into their office, it might be 3-4 days before the health department calls you and tells you, hey, you just saw somebody and they were positive. They came in your office the other day. And so what have you done to mitigate that risk so you're not shut back down for another 14 days? And that's the one fear that I have for my own practice. I'm a sole provider. I don't want to ramp back up and have to shut back down again. That scares me. Okay, and so that's just one. Teledentistry is just one extra tool you can use to mitigate that risk. And the ADA has put in some really thorough guidelines on how you can mitigate risk using PPE and screenings, and so that you can triage your patients and choose very strategically which patients you want to expose yourself to. So this just kind of highlights specifically the PPE section. So if your staff is not producing aerosols and they are using surgical masks and face shields like a diagnostic team, they can use the less costly PPE and do the less invasive diagnostic procedures to intake your patients, and they're at low risk and are not advised to quarantine for 14 days. Versus if you have people in your office and you don't have a way to contain aerosol and people have surgical masks on, the current guidelines from the CDC is they are at moderate to high risk and they should self-quarantine. So separating people in your teams up and using teledentistry to do that is one practical way that you could do this temporarily for you to be safe in your office. And this is just illustrating, so these are some of the guidelines put up by the ADA on how to safely, put on all of this extra surgical PPE that we normally didn't have to wear, and the amount of effort and care that has to go into taking it on and off. So if you're going to do teledentistry in your office and possibly separate your teams and intake patients that way, we've been talking about how to do teledentistry with a hygienist for 2-3 years now. And so both when we did it at the health center and when we started doing it, and teaching offices how to do it. And so we call them the 4 phases of teledentistry. You've got a process around the patient to coordinate their care. You've got the data collection. You've got the examination by the dentist, and you have the follow-up. And so traditional teledentistry with a dental hygienist is using pictures and x-rays, and there's other tools available where you gather the diagnostic data, and you could do a very good and scientifically proven with the literature that you can do very good exams digitally. You would take full sets of x-rays, you would take orthodontic series of photographs, and then that is the baseline for a teledentistry exam that we recommend, is a full photographic series, and then whatever x-rays the patient's due for. So a full mouth series if they're a new patient, bite wings and looking at their old x-rays if they're an existing patient, and then a PA of any tooth that has a concern during the exam. If there's suspicious lesions on there, the hygienist might see, pop a PA of that, have a protocol written out for a hygienist to follow so that they can gather all the diagnostic data that the dentist would need to feel comfortable with an exam. And then you can have a protocol where any suspicious lesion that you can see clinically to take an intraoral picture of those. There's even the dental school in Arizona at ATSU ASDO, they're actually using quadrant videos. so that the students are taught to use an intraoral camera and they take a quadrant video. So that's another way. And every system that's put in place is dependent on what the doctor feels like they need to feel comfortable closing out an exam. Another use case would be to get use your intraoral scanner if it does diagnostic imaging. And so a lot of them have been coming out with features for that. And so this is an example on the same patient I took the intraoral pictures and the x-rays on. This is her getting a digital scan done, and you can see really good detail. You can get a good lay of the land so that you can kind of see what goes with the notes that the hygienist leaves for you. And a thorough patient evaluation includes periodontal charting for adults, thorough tooth charting, and the clinical notes of the hygienist describing any suspicious lesions or signs or symptoms that the patient might have. And so as we move into the road ahead, I wanted to just outlay some of the tangible and intangible uses, impacts that teledentistry can have for your practice. So billing for limited evaluations during stay-at-home orders is one immediate use case. So if you're at home or you're quarantined, or you have providers that are home because only certain providers are back at the office, you can bill for limited evaluations when the dentist isn't there. Okay, and if you have the hygienist there, you could bill if your state allows it. You could bill for periodic exams and comp exams if a hygienist captures that data. So you could have a system in place where you're getting some revenue from evaluations, and when you start adding a hygienist to the evaluation system, and you're separating that from the dentist and doing hygiene or diagnostic team versus treatment team, you're able to minimize risk of infection and exposure, and you can include the reimbursement for your radiographs and your examination, and if prevention, once it is allowable in your state or local government, you can add the preventive care back to it. And so you could use this to also ramp up. A lot of dentists have been contacting me because they're going to have backed up, pent up recalls for months. And so they're going to use teledentistry to ramp their hygiene hours up so that the dentist doesn't have to be there the whole time. And so using teledentistry allows you to extend your hours past when the dentist is there. And that's a wonderful use of it. Some offices have laid their staff off and they have 2 offices to run. You could be intaking patients and maintaining some of them at the satellite location while the dentist is at the other location. Some of the intangible financial impact is engaging existing patients. So if you set something like this up, you are at least available even when you're not physically available for patients to just walk in or call the office. And so setting this up gives you some visibility to your patients, some accessibility, and a great way to talk to your patients while they are maybe too scared to come into the office. So you have a tool to communicate to them, and for you or your hygienist or your office staff to communicate to them and talk about that thing that could flare up on them and possibly need to come in. You can look at it and talk to them and say, yeah, that doesn't look like it's getting any better. You might need to come in here. And we're doing this and this at the office to make sure we're keeping you safe. What I've found is that the majority of the patients that I am getting while I'm offering teledentistry are new patients. And that's because most of the dental offices around me are completely closed and they have no way of getting access to care. The next thing is that you can use it to limit your exposure, like we've talked about. If you set up a messaging platform, you can message patients that before they come in for their appointments, and you can message with them in the parking lot. You can get them to, you can triage the people that really need to come in first. They can fill out all their consents ahead of time so that you don't, as many as you can get them to sign, knowing what you've triaged. If they don't have to stay inside the office for too long, exposing other patients or your staff, the better and less risk you are at getting exposure. And also, it's a good way to increase productivity. Like I said, you can expand hygiene hours. And implementing a teledentistry solution makes you stand out from the rest and gives you a cutting edge look to your practice. There is some financial assistance. So some states, well, you have the small business loan. There might be some ability to use some of that funding to implement a system. If you're in a rural situation or you are a nonprofit, there is FCC and USDA grants to allow for telehealth funding. And also, some states are offering free licenses to programs, like in Missouri, for example, and I know in Washington State, there is free Zoom licenses. You just contact some of the state organizations, and they're offering free Zoom licenses to people. The FCC funding that was released last week provides you to upgrade your internet connections, buy software that is allowing you to do teledentistry, and to get equipment such as cameras, sensors, x-ray equipment, and things you might need to offer teledentistry. And they're backdating it to March 13th. Right now, it's available only to rural locations and nonprofits. So we have a limited use. However, the ADA, I've been working with the ADA, there's the Hospital Association and the Dental Association. They're trying to open up this funding. So try to pay attention to it, because there might be funding opening options to open up to other providers. And this does not include training. So the FCC funding will not include training for how to use it, but it will allow you to get the equipment that you would need in the software. My main takeaway that I want to let you know about is just that we're not going to be back to normal. There's going to be some sort of new normal, and none of us know exactly what that's going to be. But there's two things that I think we can count on from the get-go. There is going to be definitely infection control and PPE guidelines that are going to stay with us for quite some time. And so that's one thing that's for sure certain. And the other is that telehealth is going to be here for the long term. And so adding it to your practice as a tool is a smart way to update your practice and to make you on the same bar as all the other healthcare providers that are offering this. There's so many people now exposed to telehealth services, and they want that because a majority of people don't feel safe to do things that they normally were doing 3 weeks ago. And offering this is one way to engage with them and to triage them and to potentially even find new patients. And I want to leave you just with a little quote that says that the difference between a problem and an opportunity is what you make out of it. And this pandemic is causing a lot of uncertainty, obviously, and there is a chance here that certain practices are going to take this as an opportunity and emerge and grow into some new and exciting ways. And lastly, I do offer consulting services. So if you guys are interested in it, I have a website. It's called accessteledentistry.com. My team and I are happy to help answer questions. I have some FAQs available and some documents available on there that can help you, as well as some recorded webinars. Here's my contact information if anybody would like to reach out. We also have a Facebook group that is for free. It is a teledentistry Facebook group, and it's called Mouth in the Cloud. And it has grown exponentially in the past 3 weeks. And we're happy to have you on there to ask questions of the group and share ideas. With that, I'd like to say thank you very much for the time today and listening to this presentation and considering using teledentistry. I have found it very useful and exciting for my practice and for helping people, especially during this time with COVID-19 and the uncertainty that we have moving forward. So thank you very much, everybody.
Thank you, Dr. Suter, for that valuable information on teledentistry and how it can be practical for all of us. If you have any questions or comments, please email us at webinars@henryschein.com. And please don't forget to subscribe to us on YouTube by clicking the subscribe button below. That way you'll be notified of all new and relevant information. Until we see you again, stay safe and stay informed.